Choosing the perfect health insurance in Hong Kong can be a complicated proposition. Between the different insurance policies, benefit options, and the sheer number of both local and international health insurance companies offering medical protection, simply knowing where to start can be both confusing and stressful. Adding to the intricate mix is understanding whether or not you actually need health insurance in Hong Kong at all. So, Hong Kong offers both government-subsidized public healthcare services alongside private hospitals and clinics. This means that, in stark contrast to somewhere like the USA, as a patient, you will have a tremendous amount of control with where you go to receive your medical treatment. You have the ability to seek healthcare at either a public hospital or a private one. You have control over the amount that you will ultimately spend receiving healthcare in HKSAR. This is because treatment at public medical facilities in the city will normally cost much less than healthcare facilities operated on a private basis. However, it is important to note that when it comes to the private medical costs in Hong Kong, treatment will be extremely expensive. In fact, Hong Kong is estimated by many insurance companies to have the second highest average cost of private healthcare in the world, falling only behind the USA in terms of the price point attached to treatment. This is where health insurance comes to play. When it comes to health insurance, the first thing to understand is that you will normally have no choice to opt out of inpatient protection. That is to say that all health insurance plans, whether underwritten by a Hong Kong insurance company or offered by an international health insurance provider, will include an inpatient coverage benefit as a core component of the policy. Inpatient healthcare refers to any treatment where an overnight stay in a hospital or similar facility is medically necessary. Under the best medical practice, you are required to stay at the medical provider to receive longer-term care. If you're receiving treatment at an already expensive private hospital, then the cost of care can quickly climb if you are forced to receive it on an inpatient basis, if you have to stay at the hospital or clinic for one or more nights. In fact, for many people in many countries worldwide, a single inpatient stay will often be the most expensive medical treatment they ever receive. This is because inpatient treatment covers things like heart transplants, cancer surgeries, and serious illnesses that require long-term treatment, including dengue fever, malaria, and even COVID. The seriousness of many inpatient medical concerns and the cost of their treatment is why inpatient insurance coverage comes bundled with every single health insurance option available through a Hong Kong insurance broker like CCW Global. Most inpatient health insurance coverage benefits will provide, as standard part of the policy, protection against the cost of your hospital room, with a choice of private or semi-private, surgical and anesthetic fees, operating room charges, ambulance transportation fees if applicable, organ transplant costs, and inpatient diagnostic testing fees including x-rays and MRIs. In fact, in some cases, limited outpatient services may be provided through the inpatient benefit of a health insurance policy. This will be subject to change at the insurer's discretion, but it may be possible to obtain coverage against the costs of things like specialist rehabilitation or outpatient cancer treatment with no additional premium. That's us for this week. As always, we hope you have a happy and healthy weekend. Remember to like and subscribe to stay current with all our content as it comes out. And don't forget to ask CCW. We're simplifying your insurance.